practiced as Psoriasis Awareness Month. In this context, I would like to spare some 10 minutes in discussing at length about the possibility of psoriatic arthritis. What is psoriatic arthritis? How do we diagnose? What are the possible avenues of treatment? What is the critical importance of the exercises and food with reference to psoriatic arthritis? Psoriatic arthritis is not a very rare condition. It is seen somewhere to the tune of 4 out of 1,000 patients to in some population, little higher, even up to 10 out of every 1,000 people suffering from both skin psoriasis as well as associated psoriatic arthritis. So how does this psoriatic arthritis one can come to know? See, usually, number one, you will have skin problems. Skin problem may be scaling, maybe some crack in the foot and sole, and sometimes dandruff in the scalp, and some vague red lesions in the here and there, small punctate lesions of the skin here and there. So these kind of skin lesion, along with that, when the pain starts in the joint, especially in the tips of the fingers in these lines, or in and around the small joints of the hand, elbow, wrist, foot, and any of these places, as well as in the places where the muscles get attached to the bone, we call it as enthesis. So this is how a psoriatic arthritis can be felt by any patient. An individual may have pain in the joints, pain in the way that things inserts, or in the toes, or in the fingers, and any of the joints, including the back. So when does this psoriasis develops? And in psoriasis patients, how many of us may develop this arthritis? Many studies have shown approximately 40 to 50% of the patients will develop arthritis when you have psoriasis. Usually it may take any time from few months to many years. And an average at the end of 8 to 10 years, quite a good number of people may develop psoriatic arthritis. Psoriasis occurs as a result of immune dysfunction, wherein immune cells have little lost its control. They start stimulating the healthy cells to multiply in more than what it is required, which results in skin problem. Same stimulus inside the joints produces in the synovial tissue, produces damages to the cartilage, inflammation, swelling, and all of those features. So as a nutshell, the symptom-wise, you have painful joints, stiffness in the joints, especially early morning, neck in both back and pain, general fatigue and exhaustion feeling, nail changes, which sometimes looks like a fungal infection in the nails, or nails breaks, or nails rises above the nail bed. Those are the changes which you can see in the nail, swollen fingers, swollen toes, and enthesis, where the muscle gets attached or inserted into the bones like elbow or in the foot, especially in the Achilles heel. So you may also in rare situations have eye involvement in the form of irritation in the eyes called scleritis, or inside what we call as iridocyclitis. So these are all the different features in which a psoriatic arthritis can be presented. And grossly, we divide it into 5 types. One is a distal psoriatic arthritis, where you have nail involvement as well as the last tip joints of the fingers and toes, or the back and spine. There is one entity called arthritis multiplicans. It's a very aggressive arthritis. Fortunately, it is less common, wherein within 3 to 6 months, it damages the entire hands and the foot for the patient. So before one can blink, you can see the bones are corroded and gets damaged. But usually nowadays, early detection and treatment, we could prevent a lot of patients developing these deformities. Enthesitis type, where only the inflammation in the muscle insertion will be there, where the toes or fingers are swollen, we call them as dactylitis. These are the 5 ways psoriasis can present, and sometimes we may get a combination of 2 or 3 of these varieties. So as I said, half of the psoriasis patients develop the psoriatic arthritis by the end of 10 years, often diagnosed between 40 and 50 years. It affects both men and women in equal proportion. So the risk factors for developing psoriatic arthritis: if you have a high psoriasis, extensive psoriasis, family history of a psoriatic arthritis. As you grow towards 40, 50, if you're obese, you smoke and work in an polluted environment or stay in a polluted environment, you are likely to develop psoriatic arthritis. So importance is you need to get your disease diagnosed early. If you get diagnosed early, it can reduce the severity of the disease. If you start a correct treatment right in time, you can avoid the joints damage, and also you can reduce the risk of long-term physical function. Even of late, we have realized if we reduce these inflammation, the quality of life in long run increases. Even some of the heart problem, that coronary artery disease, etc., can also be reduced if you identify early. How do we identify? We use rheumatoid factor anti-CCP to exclude rheumatoid arthritis, and patients ESR and CRP, if they are high, suggest an active disease. Synovial fluid analysis when only 1 or 2 joints involved. HLA-B27 will add to the diagnosis, especially if it is spondylotype where the back is alone involved. So treatment depends on the severity of the disease, with skin and bones are involved, whether there is involvement of the nails, whether there is involvement of others, degree of joint damage, whether it is only on the back or whether it is involving the joints outside the back, and other associated complications. We take a call on how and where to decide to treat. The basic treatment is to reduce the damage, reduce the pain, and also long-term, if possible, to get a total control of the disease. And if things works out, once it is done, gradually taper down the medication. So it just helps in keeping you completely active, healthy, and pain-free without, in long-term, developing deformities and disabilities. What are the way we can treat? One, you can treat with physiotherapy and exercise. I will delve a little more on that. Pharmacological treatment, we can use painkillers, we can use disease-modifying drugs, we can use several biologic agents, and if gets complicated, one can work with surgical process. So physical and occupational therapy helps a lot. So we can help in improving doing exercise. One can work in improving and keeping the mobility. Hot and cold pack helps to avoid pain relievers. Posture corrections helps to keep things better shape, and good physical activity and will help. And if it is very disabled, one can use adaptive equipments like crane, crutch, and other things. But if you take proper treatment over a period of time, you can get away or come out of these support measures. So how does the medication helps? You use NSAIDs to reduce inflammation, reduce joints damage, and also work in improvising the overall mobility. Corticosteroids, we would love to avoid it as far as possible. Sometimes if it is very acute or very badly exaggerated, we give that short course of steroids, either in the form of injection, either into the joint or into the muscles. Most of the time in psoriasis, we tend to avoid using steroids. Other drug is a conventional conventional disease-modifying anti-rheumatic drug. Usually we use drug methotrexate, leflunomide, apremilast, and so many other drugs which are available. In addition, nowadays we have a lot of biologic agents which are available. These are little different molecules which specifically targets the disease process. We have anti-TNF drugs. We have anti-IL-17 drug. We have a lot of others, IL-11, 12, and 23 drugs. It's a little expensive, but definitely when we encounter failure with these conventional disease-modifying anti-rheumatic drug, we can really use these drugs. The side effects of them are little lesser than this, except for the infections, but they are very expensive. So that's why normally we try first conventional DMRs, failing which, if combination of them, failing which, then we try to go for biologic medications. Physical therapy, exercises makes a lot of help. It improves your range of movements, posture control, keeping muscle strength, keeps you more agile, more mobile, and physical activity. Even many may think, how does it help when there is a painful joint? It reduces inflammation. It reduces and controls the outraging immune system. So that immune system little comes down and comes into a good homeostasis. As a result of which we do see psoriatic skin lesions, symptoms, and mobility significantly improves. As you know, when you do exercise, you feel young, you feel active, and you feel much more better and confident on yourself in your mobility. So in addition to that, you need to protect your skin. You can use a lot of creams, lotions, as well as a small, sometime a low threshold steroids are also used to reduce the skin lesions. Of course, these drugs, in addition to improving your arthritis, do help in improvising the skin lesions. And healthy diet, there is no specific diet. It's best to have a balanced diet of both proteins and carbohydrate. Somehow, patients with psoriasis have a tendency to develop diabetes and hypertension. So it's best to have a balanced diet of both carbohydrate as well as of salt so that you can avoid these complications. A good control of psoriasis has been shown to reduce the incidence of chances of developing diabetes as well as hypertension, or at least don't sometime avoid, at least postpone it as far as possible. And take fat, which is as much as required. You have to keep a watch on cholesterol and avoid processed food as far as possible. Limit alcohol, or best is to avoid alcohol. Quit smoking. That makes a huge benefit for that. Managing stress is one of the important aspects, because we do see sometimes when an individual with psoriasis gets stressed, the psoriatic skin lesions increases. So also the joints pain. Meditation, good yoga therapies, and others diverging tactics should help you to manage these stresses. Watch for your weight. Losing weight helps a lot with reference to the psoriatic arthritis. Quit smoking and try to lead a healthy life. Even women who gets in very young age group can plan their pregnancy, especially when disease is quiet, when you're not taking medications, you can plan pregnancy. Need not be worried that your next generation is going to develop psoriatic arthritis. Chance of developing psoriatic arthritis is only 25%. And we have a good treatment. The way you took the treatment, the next generation may get the treatment. And with the time progress, we are getting much better treatment options than what it was 5-10 years before. So, and this is not a fatal disease, little troublesome disease. So that being the case, I don't think we need to so much worry about the next generation having psoriasis. You can keep that fear off and you can lead a normal life. Even desiring a child is your choice. If you look for it, you can keep aside this, that you are a psoriasis patient or you had a psoriasis and you may have a problem with the next generation. So I don't think we need to so much worry about it. But only thing suggestion is when you're planning for a pregnancy, we need to avoid some other drugs. Some drugs are allowed, some drugs are not allowed. If you have a continued problem of psoriasis, we switch over to those drugs which are allowed through the pregnancy. Or the best is when you are off all the drugs, one can think of a plan for the pregnancy. So with that brief note, I think I can tell you that psoriasis is a disease which one can win over. You need to get it diagnosed very early in the part of the course of the disease. Early treatment, early diagnosis, early treatment makes a huge difference in the overall outcome of the disease. I think I have briefed you about the subtle symptoms. Even when you have a subtle symptoms, if it is only skin, get in touch with a dermatologist. If it is skin with joints, check with their rheumatologist. He should be of a great help in identifying your disease and giving appropriate and the right treatment at right time. That will make a huge difference to you. Coming early will really help with your treating doctors, because he can help in getting a quick control over the disease. I think with this brief note, please spread this message across to all your friends and colleagues who suffer from psoriasis. Psoriasis is a treatable disease. If it is picked early and treated early, we have a definite good outcome with reference to these diseases. With that brief note, I thank all of you. Please keep listening and try to spread the message that psoriasis should be detected early, should be treated early, and if done so, it will definitely help a long way with reference to the patient's care. Thank you.